What does informed consent for Lorazepam, otherwise known as Ativan, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Lorazepam, and this is a shorter-acting benzodiazepine. So it's going to reach its peak activity around 2 hours, and it will last about 4 to 6 hours in duration in total. However, you're certainly going to feel the effects of it within about 30 minutes. Lorazepam has a pretty predictable metabolism, which is helpful, making it a more preferred short-acting benzodiazepine as compared to something like alprazolam. It isn't lipophilic like alprazolam, which means that it doesn't have as rapid of an onset and offset, so it's not going to be as bad as far as causing that rebound anxiety, and it's also not going to be quite as reinforcing as something like alprazolam. Additionally, it is safe for those who have liver disease, which is helpful because a lot of times we use it for people who have alcohol use disorder, and so associated with that, they may have cirrhosis of the liver as well. It's FDA approved for the use of treatment in anxiety disorders, as well as anxiety associated with major depressive disorder, as well as insomnia. It's also used for some somatic indications like status epilepticus, which is basically when you have a persistent seizure that won't go away, you may use the lorazepam. It also can be used in general anesthesia to induce sleep. It certainly has off-label uses as well, things like panic disorder, treating alcohol withdrawal symptoms, treating chemotherapy-induced nausea. As far as side effects of the lorazepam, it's going to be potentially all the same things that all the benzodiazepines can cause. So that includes things like dizziness, unsteady gait, sedation, drowsiness, confusion or other cognitive impairment, headache, nausea, sometimes blurred vision or changes in libido. Sometimes it can actually cause a paradoxical reaction. So although it can be used to treat aggression and it can be helpful to calm people down, sometimes someone has a paradoxical reaction, they will actually get more aggressive. If too much is taken, then you may start to have issues with low respiratory rate, low blood pressure, and pulse. And so this is essentially what happens if you overdose on this type of medication. It can result in that severe respiratory depression and death. There's also the risk of tolerance, meaning that you need a higher and higher dose of the medication to get the same therapeutic effect, and this can develop pretty rapidly in some individuals. There's also the risk of dependence, meaning that when the medication is taken on a regular basis, your body becomes used to having that medication, and you will go into withdrawal if you do not have that medication. Withdrawal can be potentially very dangerous, even life-threatening. So withdrawal from benzodiazepines is very similar to the withdrawal from alcohol, and that it can lead to unstable vitals, delirium, seizures, and ultimately coma and death if it's severe enough and not addressed. And additionally, even when someone is able to get through that acute withdrawal period, usually we do that over a relatively short time frame, over weeks to months, they are at risk of something called protracted withdrawal or benzodiazepine-induced neurologic dysfunction, otherwise known as BIND. So it's important to take a slow, methodical, hyperbolic taper approach when it comes to benzodiazepines in order to allow your brain to slowly adjust to not having the medication, which should help mitigate the risk of things like BIND and protracted withdrawal. So after going through all this, I would answer any questions that the patient might have, and we would go forward making a shared decision from there. In general, I'm going to recommend taking this medication just as needed rather than on a regular basis to prevent things like tolerance, dependence, and withdrawal. If there's another psychotropic medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings or resources, and I want to be able to share those directly with you all. So if that's you, send me a DM with your email, and I'll see you in the next one.